So indications for a blood transfusion would be to increase the circulation volume after surgery, trauma, or hemorrhage, as well as to increase the number of red blood cells or to maintain hemoglobin levels in severe cases of anemia. It also provides a replacement therapy, such as clotting factors, platelets, or albumin. We'll be doing a blood transfusion. The patient's history, they're a 14-year-old girl. Her name's Kelsey Walter. Her mother will be accompanying her during this procedure. Kelsey is diagnosed with severe anemia. She'll be receiving 500 milliliters over 4 hours of AB positive red blood cells with a 500 milliliter normal saline bag.
Good morning, Kelsey. I'm Jess. I'm a student nurse at Georgian. I'm going to be administering your blood transfusion this morning.
Okay.
Can you just tell me your name and date of birth?
Kelsey Walter, September 8th, 2001.
Okay, and I'm just going to compare it to your identity bracelet here. Okay, perfect. And Kelsey, do you have any allergies?
Do I? No allergies.
Okay, so you must be Kelsey's mom.
Yeah.
Nice to meet you. I'm just going to make sure that you know everything we do will be kept confidential. And do you guys have any questions before we start?
No.
Okay, sounds good. And I have the right to go get everything ready?
Yeah.
Perfect. I'll see you guys in a bit. So this IV line has already been primed, but I'm going to demonstrate how you would prime it. So you would start by pulling the plug out of the IV bag full of our solution and the top off the catheter tubing. And then you would insert the tip of the catheter tubing into the IV bag where you pulled the plug from. Next, you'd make sure everything is closed off, which it is. It's at the bottom. And then you would squeeze the drip chamber to make sure that it's dripping, and you would ensure that it is filled at the drip rate line in the drip chamber. From there, we want to ensure that our line is patent, so we want to make sure there's no bubbles or air stuck in the IV line. So you're going to hold your ports up, and I would release the fluid. And slowly my ports would fill up. That port's full, and I would let it drain. And the tip of the IV line where you'd be inserting it into the IV catheter is always sterile.
So we're going to be using a gravity flow IV line, and by calculating the flow rate and drop rate, we're going to be actually having to count how many drops per minute, and in our calculation it was 21 drops per minute, and we'd count to make sure the appropriate flow. I'm going to include this, and once it's inserted and it's continuously flowing for that period of time, we are going to be checking the site of the IV, and we're going to do vital signs every 15 minutes.
So normal adult vital signs are 120 over 80 for a blood pressure, a pulse of 60 to 100 beats per minute, a temperature of 36.5 to 37.5 degrees Celsius, an oxygen saturation of 95 to 100%, and a respiration rate of 12 to 20 respirations per minute. So when we're checking the site of insertion every 15 minutes, we're going to be looking for any discomfort, phlebitis, infiltration or inflammation, and we'll also be checking the pump to ensure that we have a patent line, flow rate, and the effusion amount is correct.